Good morning. Today we're going to be going over Chapter 16, the cholinergic agonist and antagonist. Okay, we'll have the key points that we're going to be covering. The two groups of drugs that affect the parasympathetic nervous system and are the cholinergic agonist, also referred to as the muscarinic agonist, or the mimics. It actually mimics the parasympathetic response. And then we have the cholinergic antagonist, also known as the muscarinic antagonist, and the parasympathetics are the anticholinergics. So you have the drugs that stimulate the parasympathetic nervous system. They're also called cholinergic agonist, or the parasympathetics, because they mimic and the parasympathetic neurotransmitter acetylcholine. The acetylcholine, the neurotransmitter located at the ganglion and the parasympathetic terminal nerve ending, innervates the receptors in the organs, tissues, and glands. We have two types of cholinergic receptors, are the muscarinic receptors, which stimulate smooth muscle and slow the heart rate. You'll see that on slide 2. And the nicotinic receptor, which actually affects the skeletal muscle. Now you'll see the muscarinic muscles affects the smooth muscle. Although the drugs classified as direct-acting cholinergic antagonists, they're primarily selective for the muscular receptors. They are non-specific because they're located in the different sites causing action in various organs. So you want to remember that. And then you have the types of two cholinergic antagonists. Direct-acting cholinergic antagonists act on the receptors to activate the tissue response. In the indirect-acting cholinergic agonists act on the action of the enzyme cholinesterase, also called as acetylcholinesterase. Now you have the cholinergic agonist on slide 4. Decrease it causes the decrease in heart blood pressure, vasodilation, and the conductive of the AV node. Just remember to follow with your PowerPoints, because this time I'm not using the PowerPoints. I want you to go ahead and go along with them because of the fact, the bandwidth. Some of the people that were trying to listen to my recording and plus have the PowerPoints up at the same time, they're not able to, they don't have that bandwidth. So I'm trying to make this easier. Now, the bethine adult is medication to treat urinary retention. It helps with that vasodilation. And then the cholinergic agonist increases the tone, mobility, peristalsis and the relax the sphincter muscles. And in the stomach, that's in the stomach. And in the urinary, it increases the ureter tone. It contracts the bladder and relaxes the sphincter muscles, which stimulates urination. So we have drugs that inhibit, and the cholinesterase are called cholinesterase inhibitors. Acetylcholinesterase actually inhibitors, or the anticholinesterase. Okay, so that's on slide 6. Now we have cholinesterase inhibitors can separate into reversible inhibitors and irreversible inhibitors. Now, on slide 7, make note of the pilocarpine and the chloride. The pilo, which I always remember pilo, always associated with glaucoma. And then the bethanochol chloride, it always decreases the blood pressure, heart rate, monitors for the symptoms of the mild side effects that could happen, like basically dealing with hypotension, bradycardia. You might got diaphoretic, which is the sweating. Just go along on slide 8. You have the bronchoconstrictor, the constriction with the cardiac dysrhythmias. Just look over that, and then look over your PowerPoints, and here we'll go to PowerPoint 11. The indirect acting cholinergic agonists, they don't work on the receptor. So you remember the function of the enzyme cholinesterase. It is to break down the acetylcholine into the choline and the acetic acid. A small amount of the cholinesterase can break down a large amount of acetylcholine in a short period of time. And then you have the cholinesterase inhibitor drugs that bind to the cholinesterase, allowing the anti-acetylcholine to activate the muscarinic and the nicotinic cholinergic receptors. These actions permit skeletal muscle stimulation, which increases the force of muscular contraction. Now, the primary use of reversible cholinesterase inhibitors is to treat myasthenia gravis. Another use is to treat Alzheimer's disease. So the primary clinical indication for the irreversible cholinesterase inhibitors is glaucoma. So you'll have to use that pilo. So you'll look on slide 15. Irreversible cholinesterase inhibitors are potent agents because of the fact that they have long-acting effect. They didn't get out of the system for a while. These drugs are used to produce pupillary constriction, actually to help that canal flow, so the pressure won't build up in the globe of the eye and in turn cause the glaucoma that can lead to blindness. Now, drugs that inhibit actions of the acetylcholine by occupying the acetylcholine receptors are called cholinergic antagonists, blocking agents. Remember that. Muscarinic Agonist, the anticholinergics or cholinergic blocking agents, antispasmodics, and parasympathology. So, on you'll know that reversible with the cholinesterase. You'll want to know, how it does treat the myasthenia gravis, but remember the effects. And then the amidinium chloride and the hydrophonium used for diagnostic purposes. Now the drugs, let me see. The major body tissues and organs affected by the cholinergic groups of drugs are your heart, respiratory tract, GI tract, urinary bladder, eyes, and exocrine glands. By blocking the parasympathetic nerves, the sympathetic adrenergic nervous system dominates. The anticholinergic and the adrenergic agonists produce many of the same responses. The anticholinergic and the cholinergic drugs have opposite effects because one treats the sympathetic, one's parasympathetic. So the major responses to the anticholinergics are a decrease in the GI motility, a decrease in the salivation, and then the mydrias, and then an increase in the pulse rate. Other effects of the anticholinergic include decreased bladder contraction and decreased rigidity and tremors related to the neuromuscular excitement. So the muscarinic receptors are types of the cholinergic receptor involved in the tissue and organ responses in the anticholinergics because of the anticholinergics inhibit the actions of the anticholine by occupying the receptor sites. Now, the anticholinergic drugs may also block the effect, are direct acting parasympathetic, or the indirect acting parasympathetics. Now, several anticholinergic drugs were developed for the treatment of Parkinson. These drugs can be used alone in very different stages, early stages of the Parkinson's. They may be in combination with the levodopa and the carbidopa to control Parkinson's, or they can be used alone to treat the pseudo-Parkinson's, which some people are misdiagnosed with Parkinson's and they actually have the pseudo-Parkinson's, which results from the effects of the phenothiazines in the antipsychotic drugs, which we'll talk about more in the psychotropic, which is a tardive dyskinesia type thing. The effects of the anticholinergics on the central nervous system benefits patients who are prone to motion sickness. So you'll see that some things that are looked for, the different medications that are used to reduce the tremors and the muscle rigidity. And then that's like benzotropine, And then we have just review all the drug boxes. And then also what's contraindicated with a patient with tardive dyskinesia and glaucoma. And then the patient with glaucoma should not take anticholinergic medications. Now you'll have slide 20, the nursing process with anticholinergic associated with atropine. You'll have the assessment, nursing diagnosis, and the planning. You'll see it's used preoperatively to decrease the saliva secretion during surgery, increase the heart rate with people that are bradycardic. And then you'll want to see the always assessing the bowel sounds. It actually can cause a paralytic ileus with the anticholinergics and with that atropine because of the fact it's absent. Must be, you have to, if it's absent and it's prolonged effect post-surgery, say for instance, or even if you're just using it ongoing, if you start having a decreased, almost absent bowel sounds, you'll have to call the physician because it could be an ileus. The anticholinergics for treating motion sickness, you'll want to see that, which can cause the dry mouth, constipation. Sometimes it's in the form of the patch. Use just hard candy, ice chips, or chewing gum to help with that dry mouth. And the main action is to decrease your saliva breakdown. So that is chapter 16. Just review that, and I will go on to the next chapter.